So good afternoon. I'm Sandra Quezada, and I'm very excited and honored to be able to kick off our Joint Society Diversity Symposium, addressing this very important topic of defining unconscious bias and ways to identify it. And why should we talk about bias at DDW? Well, hopefully, if we can identify and define unconscious bias, it allows us to be able to recognize it more readily and how it might potentially be impacting our everyday work and interactions. And then if we do identify it, then maybe we can intervene and hopefully mitigate the potentially negative impact that it can have. In doing that, we then create more inclusive workspaces, which will ultimately lead to more productive and profitable, cohesive teams. And in the clinical setting, this can also translate into improved patient outcomes. So what is bias? We generally often think about this in the sort of statistical context, and there's multiple forms of bias, and we think about how it can skew our data and the interpretation of data. But in the neuropsychological context, we think of bias actually as a normal function of the human mind. These are quick associations that our brain is wired to develop to help us interact with and navigate our world. These can exist either on the conscious or unconscious level, and certainly on the unconscious level. When we develop these are developed and impact our decision-making and behavior, certainly without our awareness, without any intention or control. So then why does our brain do this? It actually ultimately serves a function of being sort of a danger detector for us, and it helps us to stay safe. It allows our brain to make these quick split-second decisions without having to consciously think about them, again, in order to stay safe. For example, if I'm crossing the street and a car is speeding toward me, I don't have to think consciously about the fact that I'm going to react very quickly and get out of the way and jump back onto the sidewalk. If I were to consciously think about it, I would see the speeding car and think, my goodness, that car is going much too quickly, well above the speed limit. If I stay here, I'm going to get hit, so I should probably move backward onto the sidewalk because, cars don't go on the sidewalk, so I'll be safe there. There's no time to have all of those thoughts, and the good news is that we don't have to. Our brain is wired to be able to have those quick split-second decisions without even having the conscious level of thinking. What's interesting is when we think about what is safe, many times that often is that which is familiar or similar to us. We feel more comfortable in those things where maybe we have some shared commonality or prior experience with positive associations, and therefore those things that are maybe unfamiliar to us or different, or maybe foreign, those feel less comfortable or even potentially could be considered unsafe. So the upside, so I think the formatting is actually not working great here. But the upside to having our brain working at this sort of automatic response and quick level is, again, that we can make these efficient reactions and responses. The downside being that potentially when we're making these quick decisions, we may not be considering all of the potentially relevant and important information that we need to make a really thoughtful and well-informed decision. So we may have blind spots as a result of these biases. So oftentimes when we think about unconscious bias, they're seen as either a positive or as a negative. However, one of the things that we work very hard to do in unconscious bias training is to establish that having the bias and developing a bias is neither a good thing or a bad thing. It's a natural process of the human mind, and it just makes us human. However, it is, I think, important to appreciate that the impact of our biases can certainly be sometimes positive or negative. So I think that this 4-quadrant exercise can be helpful to tease out that difference and appreciate that bias can go both in a negative or positive direction, and then the outcome also could be negative or positive. So for example, an example of a positive bias with a positive outcome would be maybe at this conference, I meet somebody who is a researcher, and I'm immediately drawn to this person. And on an unconscious level, it's because of the fact that her smile reminds me of my aunt, and my aunt is a wonderful person. And so I immediately feel drawn to this person. I feel this connection. We exchange emails, we exchange research and data, and then ultimately it becomes this wonderful collaborative research relationship. So a positive bias and a positive outcome. Conversely, I could give you, though, maybe that positive bias yields a negative outcome. So maybe that same positive association that I have, again, feeling that warm connection immediately that I'm not really consciously processing, again, is really because she reminds me of my aunt, because of course on the conscious level we would know that that's ridiculous and doesn't make any sense to make decisions based on that. But we do, and so then again we exchange email addresses, we exchange data, and then she takes my data and then goes and uses it to publish something and doesn't include my name on it, and oh man, I feel completely slighted and betrayed, and I completely fell for it, and it was all due to my own positive bias that I had about this person. And what's interesting when you think about it too is that association that I had connecting her memory with that of my aunt says nothing about that individual, right? It only says everything about me and reflects about what my own background, my own experiences and expectations that I had that I was imposing on that person. Finally, an example of maybe negative bias with a negative outcome would be maybe I'm reviewing a medical school application and the candidate is excellent on every level, and maybe the MCAT score is the one thing that it's a little bit more on the average or maybe slightly below average. It's not terrible, but it's also not stellar, so it's a little bit on the less competitive side. And so I decide not to interview that candidate, and ultimately they matriculate at another medical school and they're amazing. They join faculty there and they discover the cure to ALS. And man, what a loss for us that we missed out on having that brilliant mind at our institution due to this negative bias. So negative bias with a negative outcome. So many of our biases certainly can be conscious, and we can have conscious preferences, and that's, again, oftentimes formed from things that we are familiar with, sameness and similarity, and that's not unusual. But most of our biases are actually unconscious, and they, again, develop from those past experiences. And even if we don't have our own primary past experience, they can be informed by secondary information, maybe through the messages that we've absorbed and learned through our upbringing, through our education, training, through the media. So what is our social context and narrative also that informs our biases? And it's important as we're trying to identify bias to recognize it not only exists on the individual level, but it also exists on the systemic level. And it's challenging to identify bias. Probably the easiest way to do it is when we can acknowledge it on the individual level in somebody else, and especially if we're on the receiving end of that bias. It's much more challenging to acknowledge and identify our own biases, but also at the systemic level, sometimes these are so almost invisibly embedded into our social structures, into our institutions and policies that we sometimes aren't aware of them, and we don't appreciate them. And I think that if you haven't seen the film Hidden Figures, you should definitely see it. It's amazing. It's a wonderful film. It's very uplifting. It's also very educational, and I think there's a wonderful example of systemic bias. I mean, there's multiple examples of bias in this movie, and one of them is of systemic level bias. And this very powerful scene where the supervisor approaches the employee and chastises her for taking these long bathroom breaks. And, he says, "You're gone for 20 minutes at a time. What are you doing? Why are you gone for so long?" And then she has to explain to him something that he's probably never had to think about and was not aware of, which is that the only bathroom that is available and accessible to her is literally a mile away. So she's basically running a 9-minute mile to be able to relieve herself and then turn around and run that 9-minute mile back. So what a wonderful example of systemic bias. And we could think about how, we could feel good that, we've come a long way from that. But I would challenge you to also think about what are some other examples of systemic bias that we still have to work on. So for example, in our own institutions and organizations, do we have readily available and accessible gender-neutral bathrooms or lactation spaces for our faculty and our trainees, our students, our staff, and patients? So as we are getting more comfortable with understanding that we all have bias and we just own and accept that, that's really the first step to be able to identify it. I think another thing that's really important to remember, though, is that we don't all have the same biases, again, because they're formed by our background and experiences, and we all have different life experiences. And so we'll have different perspectives as well as different blind spots. And this is, in fact, why diversity works. Because when you bring people together who have these different perspectives and different blind spots, then collectively, they're going to have a much fuller and richer picture, a clearer view of what exactly is going on, and be able to tackle very complex tasks. It's also important to remember that when we talk about diversity, we're not just referring to that which is immediately visible on the surface level. So we often tend to think about race and age and gender, for example, but there's so much more underneath the surface there that's not immediately visible, such as religion and socioeconomic status and literacy, sexual orientation and gender identity. So we really have to think very broadly when we think about diversity. So I mentioned that our brain uses, really at the subconscious level, sort of our fast brain, we're talking amygdala, hippocampus, to make these quick split-second decisions that are driven by our unconscious biases. The good news is that we can then use our conscious brain, the neocortex, which is evolutionarily the newer part of our brain, to overcome that process. But it requires that we slow down. And that's hard to do because we're all very pressed for time. We're all trying to make quick decisions constantly. But if you think about how important, how impactful those decisions are, and they're often not decisions necessarily that are life or death and I have to make it in 1 second. I actually have a moment and I can pause. And so when we do that, it allows us to have the forebrain, our conscious brain, play into that decision-making process, and even we can use that uniquely human skill, which is metacognition. And what that refers to is our ability to think about how we think. And so we can, if we identify a bias, actually ask ourselves, why do I think that way? Or why do I have that association? Where is that coming from? Or where did I learn that from? So as we are working to identify these biases, we can use really mindfulness procedures and metacognition to think about our actual thought processes and have a better understanding and awareness of where those are coming from, and then question ourselves. And this is an uncomfortable thing to do, but to really question our associations and assumptions, even in the scenarios where we do have our own primary past experiences, question, are those fully representative experiences, or could there also be other truths that maybe we haven't experienced yet? It's also, I think, if we're looking for evidence of bias, it's difficult when we're finding isolated events, but rather I would encourage you to look for patterns. And sometimes when you're looking for those patterns, then that may allow those evidences of bias to rise to the surface. And again, to be able to do this, we have to pause, we have to slow down, because if we don't, oftentimes what happens is we're just reinforcing our own reflex arc of symptom and response, our own framework that we've already developed through our background and the lens through which we see the world. So it's sort of illustrated here in the cartoon. It doesn't make a difference what I say, you've already decided I'm guilty, and they say, oh, the witch can read minds. So just reinforcing what was already the bias that the accuser had. And so we have to stop, we have to slow down and question ourselves. And then these are some questions that I would offer to you as concrete questions that we can all ask ourselves to maybe look for bias and identify them. So for example, do we tend to hire the same kind of people or persons to join our practice or join our lab, etc., or do we tend to lose the same kind of people? Do we have a revolving door where maybe we notice a pattern that, man, our junior faculty just aren't staying, they're only sticking around for a year or two and then they leave? What's going on here? Similarly, do we tend to choose from among the same type of people for awards and recognition, or to be speakers or promotion and for leadership positions? And I would also throw in, do we have assumptions about people when we meet them, that we assume that they may be the speaker or not the speaker, or someone who should be a leader in the room? Also in the clinical scenario, think about who are our favorite patients. Are there any patterns there? Why are those our favorite patients? Or are there maybe those patients that are sort of our problem patients, or the ones we're less excited to see? Are there potentially some patterns there that we could identify? And then think about our committees. You know, when you're in a meeting, you're at your committee meeting, look around the room. Is it a diverse committee? Is everyone that really has a stake at the table? Are we unintentionally, potentially excluding somebody from these committees and those discussions? Or even if they're in the room, are we really fully allowing all the people at the table to contribute to that discussion and to voice their perspective and concerns? So who controls the narrative? I'll add that I think it's very important to recognize that bias is a two-way street, and in every interaction where bias is identified, remember that it can also happen in the other direction. So for example, if there's a scenario where students or trainees are concerned and state that they feel the faculty are biased against them, and they're correct. The other thing that's also true is that the students can very well be biased toward the faculty. So in all of these interactions, patient to provider, trainee to faculty, researcher to clinician, institution, community, they're all bidirectional. And when we identify bias, think about what potentially could be also happening in the other direction. Also, I put together different groups, but certainly within groups, right? Faculty to faculty, student to student, patient to patient, bias can exist on all these different levels. So if you haven't already done so, I encourage you to try and take the implicit association test, which is a quick online test. It just takes a few minutes. There are multiple different tests that you can take to help develop an awareness about potential unconscious biases that we may have that could be across different dimensions of diversity, such as race and gender and religion, national origin, et cetera. And I think we're going to hear more of a reference about that later on in the symposium. As you're doing today, continue to seek out opportunities to get more education and more training on unconscious bias. At University of Maryland School of Medicine, it's now required that all of our faculty receive unconscious bias training. We've also integrated it into the medical education curriculum for all of our medical students. But it's important to also revisit it and refresh that thought process, because even though the literature does show that these trainings do impact and influence behavior in the way that we exactly hope that they will, that impact probably lasts more so in the short term. And if we were to come back and check about a year later, people have a tendency to fall back into their similar patterns of behavior. So don't feel that any one training means that you're set for life. Like with anything else, we have to keep working at it. And so I would encourage you maybe every 6 to 12 months to continue to refresh your memory and seek out additional opportunities to revisit the concepts of unconscious bias. And of course, ask for help. We do everything better collectively than alone. And so ask your colleagues to help you out. Am I being biased here? Am I missing something here? Are we as a group potentially missing something or excluding someone from the conversation? So with that, I will end, and I do want to encourage everyone who's here to please join us at the reception that's taking place at the end of the symposium in room 6F, just around the corner to the right. Thanks.